watching WKBN 27 First News, where your news comes first in high definition.
Welcome back. Joining me today, Dr. Mike Sevilla from Salem Community Hospital, because February, the last week of February, early March is national...
Actually, all of March.
All of March. Okay, but it starts the last week of February?
No, it's just coming up. March is at the end of the month, at the end of the week, and could talk about
whatever.
it now.
We want to talk about it because March is coming right up. National Colon Cancer Awareness Month, and it's a really significant cancer. It's the second leading cause of death in terms of cancers. What is the impact of colon cancer? Well,
yeah, that's a great reason why we want to try to screen for it, because this is the second leading cancer killer in the United States right now, right after lung cancer. And when you look at some numbers, this year about 140,000 in the U.S. will be diagnosed with it, and about 52,000 will die this year. So that's why we want to be really aggressive on talking about it and letting our patients know about colon cancer.
Well, who would you consider to be at the biggest risk of having colon cancer? Who really needs to be paying attention to this right now?
Well, a lot of people talk to me about family history, and certainly that is a huge risk factor. But there are some other risk factors as well, as far as men and women over age 50, smokers, those who are obese, sedentary lifestyle. Those are big risk factors to talk to your doctor about. Hey, maybe I should, get screened for colon cancer. Maybe it's not necessarily colonoscopy. There's some other tests out there right now, but we really want to be aware of colon cancer.
Are there newer tests that are less invasive, or maybe that people might be more likely to go get that can screen for it?
Yeah, there are some like X-ray tests that can screen for colon cancer. We have that available at Salem Community Hospital. But there's some other testing out there as well that may not be as invasive as colon cancer. It's something definitely to talk to your doctor about.
Okay, and in terms of a colonoscopy, if they do find something, a polyp, which is what you would find, correct?
That's what we worry about. They get biopsied. Sometimes it could be cancer, it could be pre-cancer, so that is a huge thing that could be found.
But if you find one, what are your choices at that point? Early detection?
Yeah, it depends what it is. I mean, if it's not cancer, then sometimes they repeat the colonoscopy in a year or 2 years or 3 years. Obviously, if it's cancer, then we do treat it appropriately.
Okay, well, thank you so much for coming in to talk about it. If you have any questions about any of this, please go to our website, and you can also, WKBN.com. We'll have a link to this segment, and you can find out how to get in touch with Dr. Sevilla. We'll be right back after this.